you want to adjust any of your language options, now is the time to do that. Also, you'll see that we have video and ASL interpretation if you want to move any of your video options around and kind of get your settings. We have everything pinned on our end if you want to keep it as is. Otherwise, this is a good time to adjust your screens. All right, we're going to go ahead and get started. Thank you for joining us today for our COVID-19 update. I'm thrilled to welcome our participants today. We're going to give a brief update of kind of where our numbers are, and then we're going to chat with you about some vaccine updates. And then at the end, we will open it up for questions. So today with us, we have Dr. Eric France, Chief Medical Officer for Colorado Department of Public Health and Environment, Dr. Michelle Barron, Senior Medical Director for UC Health Infection Prevention, Dr. Judith Schley, Associate Director for Denver Public Health, and Michael G. Roos, who is a Moderna Phase 3 COVID-19 trial volunteer. He also is part of the Colorado Vaccine Equity Task Force and will join us for the portion to talk about update on vaccines. And so with that, I'm going to take it over to Dr. France.
Good afternoon. Thank you all for being here today. And I've been walking around with a smile on my face today and all week as we're into day 3 of our shipments of the COVID-19 vaccine. So it's an exciting time. I will start with a few numbers and a few reminders about where we are. Today, we continue to see cases. I think we have 3,300 that have been reported to the state. As you look at this graphic, you'll see, however, that in general, the numbers have been dropping, which is very exciting. It shows that Coloradans, the press is getting the message out of the important work that we have to do every day to make sure that we aren't continuing this pandemic and can get back to our normal lives. The next slide looks more specifically at our hospitalization rates. They're down today, I think by 14 or 17. We're under 1,500 people hospitalized at this point, and the numbers seem to be coming down. Not surprisingly, though, there is a delay, and death rates continue to remain high. It may be another week or so before we might see death rates start to decline as well. Next slide, please. I'd like to remind you all of the good work that's happened since October. If we look to the left of this graphic, you'll see we were through the month in a period of exponential growth in cases. It was a scary time in the sense that continued exponential growth would lead to hospitals being overwhelmed and ICU beds in short supply. The local communities, the local counties and their public health agencies took action at the end of October and into November that led to a plateau of cases by mid-November. By the 3rd week of November, we continued with our efforts to control this exponential growth by putting many communities in partnership with them into the red on our dial. And our hope there was that we would keep the curve flat and not see a post-holiday bump. This graphic just reminds you that we were following a series of periods or dates where we would expect to see rises in cases. And really from the 7th of December on, a Thanksgiving exposure increase would have led to increased cases. And we really haven't seen it. And we attribute that flat to the hard work of all Coloradans, to the local community, governments, commissioners, agencies that are following up the public health recommendations around our red dial positioning. I think it's important too to recognize that to date, our efforts have been using what in public health we call non-pharmacological interventions, NPI. And those are indeed wearing masks, reducing gatherings, closing restaurants, and so on. And that's all that we've had over the first 10 months. Now, of course, we have a pharmacological intervention. We have a vaccine that is 95% efficacious and safe, and we're now providing it to our first healthcare workers this week. So it's an exciting time to think that probably within 90 days, we'll see hospitalizations be reduced because of a pharmacological intervention, the vaccine. By the 1st of spring, I expect the vaccine will impact our hospitalization rates, particularly for our persons living in residential care facilities. So with these few comments, I'd like to move on to the next slide and open us up a bit for a conversation across our group around the vaccine, where we're at, and how's it going on the front lines.
Yes, and I would say that this has been an exciting week and it's only Wednesday. And so I would love to ask you guys, how's it going? Dr. Schley and Dr. Barron, in your facilities, how's it going? What's the sentiment among staff?
Everybody's so excited. There's like this energized feeling throughout the building now where everybody's just feeling like maybe there's light at the end of the tunnel coming. And I just can't tell you how much everybody's been just buzzing about this. So it's been really very exciting for us.
And this is Judy Schley, and I will totally agree. We sent out a pre-registration survey to our entire staff, and we received 7,000 responses, and 90% of the people want the vaccine. We are starting vaccinations tomorrow. We received it today, and it was like the eagle has arrived, and we were so thrilled. And everybody wants it as soon as possible. And so for us, it is great news because it has been a long year, and we are excited to then move to the next phase, which is recovery.
Thank you. And so when it comes to working with vaccines, Dr. France, Dr. Schley, and Dr. Barron, this is not something new to you or the experience or anything. I would love for you guys to take a moment to talk a little bit about, why it's important, what you're seeing with the progress, and anything else you'd really like to talk about when it comes to the vaccine and some history and your history with vaccines.
That's a good call out, Heidi. New vaccines, of course, is what we've lived through for the last 2-3 decades, if not longer. And certainly over my career, first as a pediatrician, then in public health, I've seen a number of diseases that had babies hospitalized all but disappear. And so we've been fortunate to be alive during a time where new vaccines are the norm. And this is just like those. High effectiveness, efficacy, very good protections. It will help eliminate this disease from our communities with strong safety records to date. So I encourage us all to think about this vaccine like we did with the new shingles vaccine or a new chickenpox vaccine. There's always something new coming thanks to our great technologies, and this will have a profound impact on the pandemic and get us back to our normal lives.
Dr. Schley and Dr. Barron, do you have anything that you would like to add?
I help lead immunization services at Denver Public Health, which supports the city and county of Denver. We're strong proponents of vaccinations. They change lives. They keep us safe. I remember when I was a little kid and I got the little sugar cube for polio, and how people were so excited because people had seen polio and what it did to their lives, and people that were lost because of it. We're in that same phase right now, And this vaccine, either the Moderna or the Pfizer, and I think they're interchangeable. We just can't, you have to take one of either the Moderna completed or the Pfizer completed, but they're similar as a vaccine, will change our course of our society and get us back on track and help us to just get better as a society.
And I'm just going to comment that obviously I'm a big proponent of vaccinations as well. One of the first vaccine trials that I came into encounter was when I was in college was the varicella vaccine, which is now standard of care. And I think we really should pause for a second and think how historic this is that we have a vaccine available. I sent an email back at the beginning of January talking about this virus to our leadership and saying, you know, makes me a little nervous, reminds me a little bit of SARS. And to go from that moment to now, not obviously being able to predict what we are going to see in terms of the volumes of cases, the number of deaths, but the fact that we figured out what the virus was and have vaccines, not just one, but two, it's amazing. I think it's one of these times in history that we will all look back on and think, wow, it's amazing what we can do when we have to and when we want to.
Thank you. And I think this is a great time. Michael, you have a special place in vaccine history because you are the first person to receive both the first and second Moderna trials. But you and I were having a really great conversation about your thoughts and feelings when it comes to vaccines. Would you like to share that?
When the COVID first became a pandemic, I felt there were two options: either get into the fight or try to hide from it. And we know you can't hide from it. And during that time in the summer when it just was blowing up, going out of control, I felt it was almost like a personal obligation to get involved. And also, I felt that because of the pioneers of the past, I've had a very healthy life. So I felt I needed to pay it forward. Also, I felt that, you know, within the African-American community where there's so much skepticism, and rightly so, I felt I needed to be kind of an example to the African-American community that it's okay to get involved in these kind of trials. You know, it helps everybody. The vaccine isn't race-based, you know, it's developed for people, humans. So I felt, you know, when I stepped up on August 20th for my first shot, I didn't know what to expect. But I had confidence that the phase 1 and 2 volunteers made it safe. So I felt the vaccine itself was safe. It is safe. Everyone should get it. But when I first got my shot in August, no one knew if I had the placebo or the actual vaccine. Within about 4 hours after the shot, I started having symptoms, muscle aches, body aches, you know, fatigue. I had about 7 of the 17 symptoms that were listed. And they only lasted a few hours. You know, it's so much better than actually getting the virus itself. You know, within 12 hours, I was over it. When I had the second shot on September 17th, I had similar symptoms. I had, you know, the muscle aches, body aches, fatigue. The second shot was a little more intense. It lasted about 24 hours. But after that, since September, I've been doing great. I'm glad I did it. I think people should feel comfortable that the vaccines are safe and that they will protect you. I'm involved in the long-term trial, which is 25 months. So during that time frame, it will be determined as to how long the vaccine lasts, how the efficacy will be over the next year to 2 years. But I can say that I'm very glad to be part of this.
We're happy
Thank
you
you,
are
Mike.
too.
Yeah, thank you, Michael. I'll just call out my personal thanks that you stepped up and that you participated. And you tell a story that sounds very similar to the safety data that we've received, that up to half or more will have some of these local reactions and some general symptoms, that the onset is 1 to 2 days after the vaccine, and that they last about a day. And it certainly sounds like you had that same story. Your end result, of course, is that you've now reduced your chance personally of getting COVID-19 and being hospitalized for days to weeks by 95%. So thank you for what you've done.
And, you know, it should be pointed out that I'm in a very high-risk group. I'm African American and I'm 66 years old. So it's very important that people in that age group who can get vaccinated when their turn comes up.
Thank you. And Dr. Barron, I believe you're getting the shot this week. And do you want to talk a little bit about that?
Yeah, so it's pretty exciting. You see, Health so far has given 300 vaccinations. We have clinics ongoing right now for all our 1A providers, and I'm an infectious disease physician. I actually will be on the hospital service taking care of COVID patients in the next couple of weeks. So I'm getting my vaccine on Thursday. I will self-profess that I am terrified of needles. And yet I get my vaccines every year. And so for those of you that are scared of needles, I'm with you, but it's still worthwhile to get. You just sort of cover your eyes, do whatever you need to do. The vaccine usually doesn't even hurt. It's just the idea of it that makes me so crazy about but yeah, I'm pretty excited to be part of this. And obviously it'll help me be protected and also hopefully encourage other people to get it as well. Since I run the program at our hospital, I feel like as one of the leaders who sees patients too, that's my job, is to say, yep, I'm getting it, you should get it too.
Great. I'm excited for you. And I think that's an excellent point about, and I love the story that you too have a fear of needles, and it's still, you know, I was going to ask how's everyone feeling in the hospital? Is everyone who's received it so far, are they feeling okay?
Yeah, everybody's been great. Again, everybody's just been so happy. I think we have some really great people that organize this in a way that is fast and convenient, and people are going down getting their shots. It takes them about 5 minutes to get it done. We watch them for about 15 minutes after the shot is done, just to make sure that there's no reactions that are immediate. And then they have their paperwork, and then they either go back to work or they go home or wherever they're headed to. And so again, everybody's just so excited, and it's really, again, it's one of these things that just gives me comfort that we're on our way.
I love that. Before we move on, does anyone have anything else to add?
I do have something to add. You know, I work in public health as well as working at Denver Health. I'm a family doctor and I do some clinical care. And I'm signed up, not for a while. I felt that I only do in the outpatient setting and I wanted my inpatient colleagues to get done first. And that made sense. And we didn't have an infinite amount of vaccine. This is going to take us a long time to vaccinate our people. And so we have a little process, sort of a roadmap of how we're going to do it. The state has been wonderful to provide us with some guidance on who we have to prioritize, like our long-term care facilities, our inpatient providers, our outpatient providers, our first responders. And we're going to move through to the next phase and then the following phase, but it will take time. And we have to have some patience in the process. And additionally, getting the vaccine doesn't mean you stop doing all the things you've been doing to protect yourself and your family and the community. We still have to wear masks. We still need to physically distance. We still need to wash our hands. And we still need to sort of isolate and in the sense of have that bubble. And that's hard. I will tell you, it's really hard when you want to be with family and you can't be. I've had that happen to me and it's painful, but we will get there. And I'm looking at, we'll all go on vacation in August and have a great time, because I think that's when we'll sort of, things will calm down. And I appreciate our state health people who have been, the immunization program has been phenomenal in giving us as much information as we can get. And they've been working so hard to get this uplifted. So thank you.
Great.
Thank you, Judy. I thought that was a nice way of summarizing it. So we're now in this phase of non-pharmacological interventions, these wearings of masks and following policies, and we have to keep that up for the next few 3-6 months as we move into the pharmacological intervention that will let us get back to our normal lives. So I'm ready for other questions, Heidi, or if
Yeah.
anybody else needs to make any final comments, feel
What I
free.
was going to say, you guys segued for me. Excellent. Yeah, if you guys have anything else to add, and then we'll open it up for questions from the media. Great. All right, so with that, it is now time for our Q&A portion. We will use the raise hand function. I will call on you, and if you could say your name and the outlet that you're with. And then I'd also ask that if you have any questions that are kind of outside the scope of what we talked about today, or maybe a little bit lengthier, if you want to send those to media_info@state.co.us, our media team can help get you some answers. And with that, we will start with Jessica Seaman. If you could say which outlet you're with.
Hey, I'm with the Denver Post. I know we're not there yet, but when we do get kind of to the second phase where it's more available to the public, can you tell us a little bit about how that distribution will work and how the state will make sure that, there is an equitable distribution and making sure that, it does get to people of color who have been, hit hardest by the pandemic?
Thanks for the question. I'll take a stab at it. It's certainly in our future, so we're looking at it and thinking that maybe by March we'll be ready to move into that. And it's clear that there's a lot of discussions that we'll need to have to hash out the plans. We know that there's at least 1.8 million people, if not more, in this next segment, and we won't get all of them vaccinated on day one. So as the state works with Denver Health and Denver Public Health, we'll work with them to say, here are the doses that we have coming in its first shipment. Where should we first vaccinate? And I know that Denver Public Health will be thinking about those communities that have the highest rates of disease and are at the highest risk of hospitalization, and will likely be prioritizing those areas for those first doses. And so I would say it's a work in progress as we partner with the local public health agencies and communities to plan for the phase 2. And clearly the principle of giving it those first doses to those most in need will be at the top of our plans.
If I may just add one thing, I apologize, didn't mean to interrupt you, Dr. France. Is in Denver, we have been doing some really nice work where we've been using flu vaccination engagement with community, with our community partners to really push out flu using firehouses, parks and rec, food banks, all sorts of places, building relationships with folks to actually start to build the infrastructure so that when we have this COVID vaccine, we have relationships with people, and then we've built trust so that we can then go to those organizations and places where people are maybe not connected into healthcare, and then we can provide them services. Our healthcare programs that do clinical outpatient work will be foundational in reaching a lot of the people that we need to take care of, people with health issues like diabetes and emphysema, and people who are older. But we'll then work on all those sort of subgroups, and the state, I know, will help us sort of think through all those caveats, because it's going to be a big lift.
And I'm just going to add one last thing on this. We were very fortunate at UC Health at University of Colorado Hospital to be a site for the Moderna trial. And part of the mandate of part of the protocol for the Moderna trial was very specific about looking at specific groups, whether it's age, comorbidities, race, and ethnicities. And so as a result of that, we're really lucky in that we have that infrastructure now to where if you needed us when the state gives us the mandate and says, this is where we want you to target, we can go through our health system, identify those individuals, and then make outreach to make sure that they understand that they are part of the group that should get the vaccine. And we've developed multiple ways to access and reach them to make sure that they get their questions answered and hopefully get their vaccine.
Great, thank you. Tracy, we're going to take it over to you, and if you could say which outlet that you're with.
Hi, my name's Tracy Harmon, and I work for the Pueblo Chieftain. And Dr. France, I was wondering if you could tell us what plans are for I can't even say it, vaccinating the 592 at-risk inmates that we have in Colorado who are age 65 or older, and also the correctional officers.
Those are two groups, as you know, that are in that phase 2 effort. We're not making a distinction based on where you live. And so we'll be planning and preparing to provide vaccines for those groups once we're through phases 1A and 1B, the healthcare workers and the folks in the residential care facilities. So while you're appropriately focusing on the next phase, we certainly have our heads down and just are focusing on getting vaccines delivered and into arms of those people most at risk in long-term care facilities, which should start the week of December 28th, and of course the healthcare workers over the next 10 days. So I would say we recognize it as a very important group to be vaccinated, and we'll certainly lift our heads up to focus on them soon. In the meantime, we're busy vaccinating and moving vaccine.
Thank you.
Great, thank you. Now we'll take it over to Taylor, and if you could say which outlet you're with.
Hi there, Taylor Summers for NBC News Radio in Colorado. I just had a question. This is relative to something we heard earlier today out of Alaska, where a vaccine recipient had an allergic reaction, needed to be hospitalized. She's in good condition, thankfully. But I was wondering if you could describe the process that you use to monitor vaccine recipients in case they have these sorts of rare reactions.
Michelle, that sounds like it's teed up for you. I'm
Sure,
certainly
yeah.
happy to follow.
Yep. So so there's two groupings. So if you tell us you've never had a reaction, you never had any complications, then we'll watch you for 15 minutes. So we have an area of where we're giving the vaccines that still allows people to be socially distant and they're masked. And we watch them. They have people that are just paying attention to them to make sure that they're not getting woozy, if they're having any complaints of anything, shortness of breath or otherwise. We have nurses on site that can evaluate them. If it's something simple, like they just need something to eat or they need something to drink, we have that available. If it's something more serious where they're starting to have issues breathing, we have a protocol and we have medications ready to go. So if somebody's having a serious allergic reaction, we have epinephrine available and ready to go. There's a protocol that we follow for all immunizations, not just this one, and they follow through. And obviously, if somebody is really not able to be stabilized in a timely fashion or looks like it's getting potentially worse, we have the ability to get our either call 911 depending on the location of where we're giving our vaccines, or have them transported to our emergency department for further care.
And that's the same process we're using too.
Great, thank you. Chris, we're going to take it over to you, and if you could say which outlet you're with.
Chris Vanderveen with 9 News. First, it's more of a statement, and then I'll have a question for Dr. Barron. The first one is, and maybe I'll phrase this as a question. I hope there is a plan from CDPHE to distribute how the vaccine distribution is going, much in the same way that is happening with public disclosure of data now. So one, hopefully we're going to see that with the vaccine distribution. So I guess that's sort of a question. And my second question to Dr. Barron, you've been all over this from the very beginning. What is the one thing that you'd recommend schools do right now to try to open up effectively come next month with students inside those schools? What should schools be doing now, in your mind, to ready themselves for January?
So Chris, I'm actually going to jump in real quick and give you some good news that we are building a dashboard to help with your first part. So that's exciting news, and more to come on that. And then now I'll go ahead and pass it on over to talk about your second question.
And I'll certainly ask Dr. Schley to pipe in as well, because I think this is a complicated question in terms of what's the exact answer. And so I think with the hope of opening schools, obviously, there's so many factors with this. I think the key for us to getting schools open, our communities back open, is obviously widespread uptake of the vaccine and continuing just being good with our transmission control, wearing those masks, social distancing, not having mass gatherings, even though the holidays are coming. And this is going to be that time where I think all of us have that tug and say, ooh, but we could just do it. But one person matters. One person doing the right thing has implications beyond one more person. The rate of spread of this, when it's high, can affect anywhere from 2 to 4 people at any given time. So one person not doing something that's beyond what we've been recommending certainly helps with that. And so I don't know if Dr. Schley has anything, or Dr. France has additional things. I think this is, again, kind of a complicated question, but I think the key is people getting the vaccine and still following the messaging.
I'm just going to say that there was a news conference yesterday with superintendents in the metro area and the region, as well as physicians that have been very much involved with how to address school opening. And I work with a group called the Metro Denver Partnership of Health, and we with Colorado Health Institute put out something just yesterday about safe openings of schools. And there's all the modalities that have been done for now, trying to keep community transmission lower so that there isn't so much that could be brought into a school. I think schools can be safely administered face-to-face, and particularly for the young kids, if we keep community transmission down. And then we're hoping that the vaccine, we can vaccinate school personnel at the point where we can get there, so that they can, the teachers are there and then they're able to educate our students. And then there's other things that are involved with reducing some of the quarantine timeframes, testing students who have been quarantined. Those are all things that have been worked on. And I'm not an expert in all that, but I know a lot of people put a lot of effort into it.
Maybe I'll just add at the end here that, of course, as they've both said, it's all about first making sure that our cases are low in the community. And that's the foundation by which a school face-to-face will be achieved. And in particular, for me, that means that we need to promote, and you need to help us in promoting, the importance of safe behavior, staying within your bubble, not traveling over the holiday period, not having big holiday parties or New Year's parties, because that kind of behavior the week of Christmas and New Year's will be translated into increased case rates in early January. And that's what everyone's going to look at when they're making decisions about can schools open. So we need to do our part as a community, as individuals, so that we can do whatever we can to make schools open in January.
Great, thank you. Erin, we're going to take it over to you. And if you could say which outlet you're with.
Hi, this is Erin Prater with the Gazette in Denver and Colorado Springs. Similar or related question here. Just curious, as far as deaths, I know we were expected to hit between maybe 6,000 or 7,000 this year by the end of the year. Are we still on track for that? Or, having not seen a real surge after the Thanksgiving holiday, how many might we see this year? And, also in light of the fact that we just passed 4,000 deaths among cases. Thank you.
I believe we are potentially on track to be between 5,000 and 6,000 deaths reported today. I think we're 71. It's a high number. In April, May, we were 35 to 40 a day at our peak. Some of this is maybe some catch-up reporting. So the numbers are always a little bit not final, early numbers for any given day. However, we do expect them to continue to rise, and unfortunately, those numbers you quoted, I think 5,000 to 6,000, is still very possible by the end of the year.
Great, thank you. John, we're going to take it over to you, and if you could say which outlet you're with.
Hi, everyone. It's John Engold from the Colorado Sun. Thank you for taking my question. So the Catholic bishops of the three Catholic dioceses in Colorado released a letter this week expressing some moral concerns, not so much about the Pfizer and the Moderna vaccines, but the vaccines that are next up in the development pipeline, like the AstraZeneca vaccine. Their contention is that those vaccines use cell lines that are derived from tissue from aborted fetuses to in the research, but also in the development and production of those vaccines. And so I'm just wondering, from your understanding, that what is the scientific basis for that? To what extent are those cell lines used in the development and production of those vaccines? And then what would you say to people who have a moral concern about taking a vaccine, and to what extent in the later phases, when there are more vaccines available, to what extent are people actually going to be able to choose the individual vaccine that they take? Thanks.
Maybe I'll start with some high level comments and let others jump in. This question about the development of vaccines that potentially might involve certain cell lines have been around for a while. And I know that faith leaders in the Muslim, Catholic, Protestant, Jewish faith traditions, high level leaders have over the years made comments. Oftentimes their comments and conclusions have been that the propensity of good created by the vaccine favors the vaccine use. And I cannot speak specifically regarding the letter you describe, nor have I heard the specifics around this to date. I would say it's not necessarily a new issue, and historically has been addressed by faith leaders across our faith tradition, oftentimes concluding that the good outweighs any potential downside or the bad associated with that. I think oftentimes these cell lines were created maybe decades ago, and I think as things change over time, this question does arise today about their use. So it seems more of a faith question in some ways than a science question.
And will people be able to choose which vaccine they get in the later phases?
Yeah, stay tuned, John. That's a good question. I imagine if there's a big supply, there will be choice available based on folks. If there isn't a choice, it may be you get what you get, or you choose not to be vaccinated, since vaccination ultimately is an individual decision.
Great, thank you. Seth, we'll take it over to you, and if you could say which outlet you're with.
Hi, this is Seth Klayman, also with the Gazette. Curious, that survey showed that about 2/3 of Colorado is willing to get this vaccine. One, do you consider that sufficient? And two, if not, what can health officials do to bump that number upwards and get higher percentages of vaccine uptake? Thank you.
So I don't, there's something called herd protection, which is sort of how much of the community is protected from a disease that we can say that there's enough to make it so somebody who is unable to take the vaccine because of, say, severe cancer or whatever, is still protected. We really don't know that number yet. because we don't know enough yet about this. I mean, we've only had this disease for what, a year and 9 months in our country, so, or 10 months or so. So there's still a lot to learn. And so we'll not know that. The more, the better. I think that's the one answer that I would say. And so as many of us as possible, I'll just tell you, I'm ecstatic about getting this vaccine. I mean, I've worked every day since February, a lot. And I know a lot of my colleagues have. And this is like the best news we've had in so long. And so we just all need to try and get it. We need to promote it. We need to say it's really a good thing. Michael just talked about it and his service to our communities and to the people. And, you know, that's, I think, the best thing to think about right now.
Yeah, definitely the more the better. And I think we do want to be able to show people, like as physicians, that we're getting it. People in the community need to show that they're getting it. I think that it provides benefit to the entire community. So everybody doing their part is obviously a huge piece of this. In addition to the obvious that it protects you as well. So I think as we really want to make sure that all sectors of the communities from all different neighborhoods, backgrounds, et cetera, are encouraged to do so. And we really want to make sure that we continue to work on that, even when the uptake starts to be good. That 1/3 still matters. And I think it's important for us to really try and figure out what are their concerns or what are the issues and try to address them.
Michael, is there anything that you want to add?
I might add that the Colorado Vaccine Equity Task Force is trying to reach out to all the communities of color and trying to dispel the myths and put out the correct information so that people are not afraid to get the vaccines. And I know I'm going to do my part to reach out to all the communities also to make sure they understand that the vaccine is safe and that it's important that they get it. It could be a pivotal moment in their lives, you know, they save some of their family members from dying of this.
And I choose to remain optimistic. Sometimes surveys and polls are wrong. As we saw with the recent presidential elections, we're much closer than the polls would have suggested. Surveys suggest that 2 of 3 in Colorado will be wanting to be vaccinated. I actually think it's probably closer to 80 to 90% will be vaccinated. Historically, when I was a pediatrician seeing patients, we believed that 7 of every 10 families just followed our recommendations. 2 to 3 out of 10 had some extra questions, and once we answered those questions, they were accepting of the vaccines. And there was maybe a small minority of 2 to 3% of people that were truly anti-vaccine and weren't going to be moved. I believe as we see people step up, roll their sleeves like Michael has and all the healthcare workers have, that will inspire confidence, and we will have high rates of vaccination in our state.
Great, thank you. Blair, we'll take it over to you, and if you could say which outlet you're with.
Hi, it's Blair Miller with Denver 7. 2 quick questions. The first one's for Dr. Schley, and it was just referencing something you said earlier about a survey. Was that a survey of Denver Health employees, the 7,000 who said they were looking to get vaccinated?
Yeah, we send it out to all our workers. I mean, it takes a process to get it out to everybody, contractors, students, residents, all those folks. But of the 7,000 surveys that went out, we had 90% of people wanting the vaccine, which is pretty strong. That's our healthcare workforce.
Okay, great. Yeah, I was just wanting to clarify exactly who it went to, but that was perfect. And then second question is more kind of along the lines of what Taylor asked about. But have we seen any, you know, I guess, strong allergic reactions in Colorado so far to the vaccines? And sort of regarding, you know, the side effects from the vaccine, why is it that the second dose seems to carry more of those short-term side effects than the first dose?
So we haven't seen it, you know, we just started giving the vaccine on Monday in the state, and so we haven't seen it. I will say that there's lots of safeguards for vaccines, like everybody who is getting the vaccine will get information on something called vSafe that the CDC set up to be able to report things. And there has been long tradition of lots of safety measures and monitoring that's done through the pharmaceutical companies, but also through the CDC, the FDA, that we'll be using to follow all the things. And so there's just a lot of hypervigilance on anything that's going on right now. And if we think about lots and lots of people getting the vaccine, there are going to be a small number of events. And we don't want anybody to have an allergic reaction, but we also know that it can happen just in the course of things. And this is a new vaccine.
And I can answer the second part of your question regarding the, or at least I can hypothesize based on what I know. So your immune system is, think of it as a highly trained army. And when you give the first vaccine, it's being taught that this is an enemy. And if you see it again, it wants to be full force and prepared to be able to attack it. And so when you have that second dose, your body's already been primed to recognize it. And so when it does, your immune system, not everyone will have the side effects, obviously, but the reaction is your immune system really saying, aha, I saw you before and I'm ready for you now. And so that's why often when you have multiple series of vaccines, sometimes the second dose will be more, will affect people with more symptoms or side effects potentially, just because your immune system's been primed for it.
I might just call out too, based on your question, that the state of Colorado is actually one of the premier research sites for vaccine safety between the University of Colorado, Denver Health, Children's Hospital, Kaiser Permanente. There's over 20 years of experience. There's some very large data link sets here that are used, that Colorado participates in and publishes routinely on vaccine safety. And I know many of our local investigators and researchers who are known nationally and internationally for their work will be involved with vaccine safety oversight for this new vaccine. And maybe there's another time where there can be an organized conversation with some of them for your interest.
Great, thank you. Jessica, we'll take it over to you, and if you could say which outlet you're with.
Thank you so much. This is Jessica Porter with Denver 7. So yesterday our station reached out to CDPHE and you guys told us about 294 doses were distributed so far. Do you know how many vaccines can be distributed per day, and how will this help you guys prepare to vaccinate the general public in the coming months?
So just to clarify on your words, we had about 46,800 doses shipped to us Monday, Tuesday, Wednesday, and we expect going forward every week we'll get a shipment on Monday, Tuesday, and Wednesday. So it's divided into 3 shipments. I think it was 8,700 doses on Monday. It was 12,000 today, and the difference on Tuesday. And they go into the centers where they're stored. And from that storage site, then they're distributed across vaccination centers. And so I think we've had at least 860 people who have received vaccination in the last couple of days. It's a small number compared to the total number of doses that have arrived. And of course, everybody will be busy Wednesday, Thursday, Friday of this week providing vaccinations. And so completions will rise. You'll see that track on the new dashboard that we'll be building through the State Health Department. We, on Friday, will put forward our next order for Pfizer vaccines. And that will be the cadence: Monday, Tuesday, Wednesday arrivals, and Friday's new orders, with distribution and doses to the site during the week.
And just one more question. I was reading some states like Tennessee are saving some vaccines for an emergency backup. Is Colorado doing anything like that, or are we using everything we get?
I believe we're using everything we get. I have not heard that we're putting anything. The governor feels strongly that nothing can be wasted and it needs to be used. I would say that I'd ask Heidi to follow up with our incident commander, Scott Bookman, just to be sure that that's true.
Yes,
Thank you.
sounds good. Thank
Thank
you.
you.
And Libby, we'll take it over to you. And if you could say which outlet you're with.
Hi, this is Libby Smith with CBS 4. I wanted to see if anyone could address why the vaccine might be causing allergies. Are there proteins or something created by the vaccine which are triggering allergic reactions?
Well, maybe I'll let Michelle start, my infectious disease partner here, and then I can.
Sure. We understand that at least part of the allergic reactions, at least the ones that they observed in England, were due. The vaccine is formulated with lipids, and with all things that those are the components that seem to trigger the reaction. And I don't know that those are always predictable. I think sometimes it's just what happens when you put something like that, and it can be very immunogenic and people can react to it. But so far it seems like it's not that common, but when it does happen, obviously it's something that we have to pay attention to. And sort of alluding to what Judy and Dr. LaFrance have also talked about was, Dr. Slade, that we'll be monitoring these things. So I think it'll become more and more obvious to us what the components that are causing this are.
If I'd add anything to it, it would be to be sure you're aware of the vaccine safety infrastructure that exists in the United States. Not only do we have these very large data sets where they're doing safety studies looking for rare events, there's also a network of sites that are called the Clinical Immunization Safety Assessment Sites, or CISA, C-I-S-A. And these are allergists, infectious disease specialists, they're medical specialists, and patients can be sent to one of those sites if they have an unusual reaction to a vaccine, so that we can study and learn what's unique about them that they had such a reaction. And so CISA was pulled together when the CDC was seeing these reactions, severe allergic reactions, and asked what could be causing them. And there was this component of polyethylene glycol, or PEG, that is part of the manufacture process of both the Pfizer and the Moderna vaccine. And the allergy specialists at the CISA centers were wondering that if that could potentially be the thing that's triggering these severe allergic reactions. More to learn, though, as we go forward.
Great, thank you. And I think we can do one more quick one. And then if I did not get a chance to get to your question, please send those to media_info@state.co.us. And Vinny, you're our last one.
Thank you very much. Sorry for the late question, but listening to everyone else, this is Vinny Del Giudice at Bloomberg News in Denver. How has the delivery and storage been going for the last 24, 48 hours? Any glitches to note, or things pretty smooth? Thank you very much.
Everything's been great for us. We get the FedEx notices. It shows up when it's supposed to. We were prepared for the storage and had plans in place to where it needed to be delivered when we started administering. So far, everything's just been going great.
This is Judy Schley, and I love our ultra cold freezer. I have a picture of me in front of it. It's so beautiful. And everything is worked out. We have an arrival group that really takes care of everything, from logistics to pharmacy to security to everybody, so that we are all in sync and everything works seamlessly today. And we're going to start vaccinating tomorrow.
Well, yeah, Vinny, I haven't heard anything at the state level of any concerns. And it sounds like maybe all the planning and even the dress rehearsals are paying off, with things going smoothly so far.
Great, thank you. All right, and with that, I want to say thank you so much to Dr. France, Dr. Barron, Dr. Schley, and Mr. Roos, and of course our ASL. We have our interpreter, Sean, and then we have Sarah, who's been doing your Spanish translation today, and thank you so much for that. And on that note, if you have any other questions, please send them to media_info@state.co.us, and I hope you guys have a great rest of your day. Thank you.
Thanks, everybody.